Hey, what's up? Dr. Taylor, Aspire Chiropractic. Today, I want to bring up something that it comes up on the office every now and then, but everyone always brings it up in almost like a questionable format. Like, hey, I don't know if you can help me, but Dr. Taylor, do you know anything about TMJ? I don't know if you can help me, but can you look at my jaw? I don't know if you can help me, but I've got this thing going on right in here. The answer, yes, we can help you. So TMJ, what is TMJ? Actually, TMJ is the wrong name, but it's just what everyone knows. TMJ stands for temporomandibular joint. Basically, it's this joint right here. If this is your jaw, right, the lower part, here's the top part there, it's that area right in there. So to understand the issues that we've got going on with that, we need to understand the mechanics of the joint. So we've got the top of the jaw right up in here, and it sits in this little cavity. And there's something in there that you might find somewhere else in your body. It's called a meniscus. And it's just basically this little piece of cartilage that allows the opening and closing to happen nice and smooth. Now, the jaw in and of itself has different mechanics than damn near any other joint in the body. So if we go back to this cavity here, when you're sitting with your mouth shut, as a good kid will do in school because that's what you're told to do, that's neither here nor there. That's a different story. What happens is our jaw's sitting in the back part of this cavity here. But when we go to open our mouth, this part here moves forward, okay? We go back like this into that cavity. So it tilts forward like that. So that meniscus that we were talking about earlier changes shape. Now what happens is while people come in and they'll have TMJ issues, they'll have lockjaw, they'll have a clicking, the mouth will deviate to the side when they open up. What will happen is this meniscus, this chunk of tissue, will get lodged, stuck, or jammed in there, typically in the open position, and that means the mouth has trouble going back into neutral, right? So from a chiropractic standpoint, how do we fix that? How do we address that? Well, this meniscus, it's lifeless, for lack of a better word. It doesn't do anything. It's there to just take part in a motion. So what we need to do is we need to address the stuff that's screwing up the motion in the first place. A couple of the most common culprits are literally just going to be muscles in your head. There are two main muscles when it comes to opening and closing the jaw. One is right up above your ear here. It's called the temporalis. Fans open just like that and attaches right down in there. And then the other one is a muscle called your masseter. Fun fact, it is the strongest muscle in the body. Why? Because it's the one that closes your mouth, right? This is a big fat thing right in there. More often than not, we'll get dysfunction in one of these two muscles, and that causes the jaw to open and deviate to the left, deviate to the right, or just not close properly. And you can usually find little knots right in here along the side of your jaw. This is called the ramus, or right up in here, right along your temple, because those are the muscles, like I said, that help close the mouth. So from a chiropractic standpoint, what do? We assess those muscles there. We assess those muscles there. Is there any dysfunction in there? Is one stretching more or less than another one? Now, if you really want to get into it, no pun intended, we're going to take this face, we're going to turn it so it's looking right at us. So here we're looking into the mouth, like so. Put some teeth in there, some teeth in there. There are muscles inside your cheek called your pterygoid, PTY, like pterodactyl, right inside there. Same thing. They help close the mouth, and those can get knotted up and not work right either. Now, the way you go after those, get a gloved hand, put the finger in there, start to strip those out, just like you would strip out the muscles in your back or something like that. So good news is we don't have gloves here. Why is that a good news? Because that means I'm not going in your mouth. You're fine. You go somewhere else for that. I don't want to do that. I'm going to help you. I'm going to help you on the outside. So TMJ, temporomandibular joint. It's not a disease. It's not a dysfunction. If you've got an issue with something going on here, you'll come in, your dentist will say, yes, I've got TMJ. We all do. No, you've got TMJ dysfunction. How do we fix the dysfunction? We work on the things that make that joint move. Because if they're supposed to make it move, then they can get screwed up and then it's not going to move right. And then you're going to come in here with those aches and those pains. Now, what causes all this? I mean, it could be a number of things. You sleep on the side of your face, your jaw gets shoved over to the side, you wake up, you've got TMJ. Everlasting gobstopper, lasts forever. Try and bite into it. Bust some teeth. Boom, you got TMJ. You talk too damn much. You get TMJ. Either way, whatever the cause or the solution. You ever get any trouble with any of this stuff up here in your jaw, up in your head, top of your neck, screwing with you up here, just give us a buzz, walk right in through that door. We're ready to help you when you're ready to be your best. Right here at Aspire Chiropractic. Naturally.